Hello everybody, I am Dr.Ananda Sagari, consultant family physician and diabetologist. Today I have come in front of you with a very important topic which I felt was a common problem in every household is obstructive sleep apnea, OSA we call it. But I'd like to give a little glimpse of this. If you notice someone of your near and dear snoring very loudly and they keep complaining in the morning that they never had a good sleep and they always are feeling drowsy, irritated, or they say that, I didn't have a good sleep and I'm feeling de energized, then I think you should check for this cause that is obstructive sleep apnea. What happens is either because of age or because of our obesity, when there is excessive fat in the neck area, the muscles or the tissues in the backside of our throat, for example our soft palate and our tonsillar tissues, these and even the tongue for example sometimes may collapse back, restricting the airway, or there will be difficulty in breathing because the air passage gets narrower as these tissues fall back. That is the moment when you experience suddenly being choked up in the middle of the sleep. As a natural instinct, you get awake immediately and you would want to readjust your position and sleep. Imagine this happening for almost 20-30 times in 1 hour of your sleep, and all the 5-6 hours if you're experiencing this, that means you never had a good sleep at all. In such conditions, when you wake up, obviously you feel tired, exhausted, and you may experience, in fact, a very good sleep while you're sitting down because the tissues are not collapsing. There is good amount of oxygen going to your brain, so you might feel sleepy when you're sitting and eating, or reading a newspaper, or watching a TV, or talking to someone in severe cases. If you are noticing anything of this, please meet your nearest ENT physician or an ENT surgeon to get this sorted. You may wake up with symptoms of not only disturbed sleep but also dry mouth, throat pain, or feeling tired, irritable, and sometimes your blood pressure are also rising. If you ask me, every snoring person may not have this OSA, but if you're adults aged above 50 years having diabetes or any heart conditions or blood pressure and are a little overweight and waking up with disturbed sleep or not so energized every time, it's good to check up. I would not say everybody has to go through a surgical process or something, but it's good to check up. And definitely, there are remedial measures for this. The most common and simple that we can do at home is trying to reduce our weight, which is a long term process. Number two, practicing good pranayama, that is breathing exercises, which you all know, you can find them in the YouTube as well. And third and most important thing is to put your head end elevated. Never sleep with your body and head like this flat. Try to elevate your head end with the support of some pillows below and turn to one side and sleep. In spite of doing all this, if still you're snoring loud or waking up in the middle of the sleep saying that I'm unable to breathe, then you should visit the doctor. The doctor may advise you for a sleep study wherein a machine is connected to you while you're sleeping and it records the number of times your sleep was interrupted, how it has affected your heart rate in the middle of the sleep, your blood pressure, and even your oxygen and carbon dioxide levels. If these things indicate a little severity, that's when your ENT surgeon may ask you to use certain devices which open your nasal airway or oral airway. And if this also fails, they may do a simple surgical process, that is, the tissues which I said are falling in the back of your neck and causing obstruction to your throat, they may surgically operate and remove them. Remember, there is treatment, there is a solution. Not to panic, but do not ignore this. If you notice your near and dear or your family members, anybody suffering with this high, loud snoring, all the time feeling sleepy at the daytime, and if they have these risk conditions, take them to the ENT doctor. I hope this piece of information helps you all. Take care, stay safe.